Hello, welcome to my frequently asked questions. Today I'm answering a commonly asked question: how do I find the very best blepharoplasty or eyelid surgeon for me? And in answering this question, how do I find this person? What do I need to look for? So in terms of this question, well, there's a few things that we need to consider. And first of all, well, what are the important criteria in terms of this? And really there's 7 things that I'm going to go through with you today. First of all, well, what credentials in my surgeon should I look for? Secondly, what experience should the surgeon have? Thirdly, what I think is particularly important is past photographs. 4, detailed orientation. 5, reviews of your surgeon. 6, proven results. And 7, a few tips that I feel are particularly helpful. So first of all, well, an introduction to myself. My name is Dr. Julian Silva. I'm a London-based oculofacial, cosmetic and plastic surgeon, and I only do facial, cosmetic and plastic surgery. And blepharoplasty is a surgery that I do every day for my patients, and so this is an area that I specialize in. Although this information is meant to be helpful to you, it can never replace a consultation in person, because much of this information needs to be specialized towards you. So first of all, what about credentials? Because there are many different types of doctors, cosmetic surgeons, plastic surgeons. So what are the right credentials? Well, different specialties in medicine specialize in different areas. I personally specialize in oculofacial plastic surgery. There are other surgeons who specialize in ENT and facial plastic surgery. There are surgeons who specialize in maxillary facial surgery, where they did dental surgery before studying medicine. And of course, there are plastic surgeons who practice plastic surgery over the entire body. And all of these specialties are able to complete blepharoplasty. And in certain countries like the US, well, some dermatologists have also done additional training and also practiced surgery. And of course, board certification and those qualifications are very important. And one can look at the fellowship training that the surgeons have done. You can look at publications they've done, awards that they've achieved. All of these factors, I think, are important. And this explains the credentials. I think in addition to the right credentials, well, your surgeon needs to have extensive experience in blepharoplasty. And in that, it needs to be a procedure that they're completing every day for patients, because a lot is in the detail around eyelid surgery. And so you really want a surgeon who's specializing predominantly in eyelid surgery or blepharoplasty and doing less other things. And less other things may be less body surgery like breast augmentation or liposuction. It might be less dental work in terms of maxillary facial surgery, but you really want someone who's doing eyelid surgery and blepharoplasty every day to really look at the finer details. How much per week? Well, I would say you should be doing 1 blepharoplasty at least a day in order to really have experience in this area. And then in terms of years, well, the more experience the better. Malcolm Gladwell wrote this excellent book on outliers, where he said to be a true specialist in any area or any field, you really need to have spent 10,000 hours in that area. And that really quantifies into many years of specializing. I find old photos particularly helpful because there's so much natural variation in the appearance of our eyes. And a few years ago, Renée Zellweger, an A-list celebrity and actress from Hollywood, she had a cosmetic procedure that really changed her appearance. And the reason that happened was that the surgery that was done didn't respect the old characteristics of her face, and it opened up her eyes a lot more. She had brow lift and blepharoplasty, and it wasn't conservative, and so that change in her appearance, well, it really drew in the media attention because she looked different. So let's have a look at another A-list celebrity, Jennifer Lawrence. Well, she's a lady, many of her movies were done in her 20s. And if you look at some of those movies like Hunger Games, well, some of those movies you can hardly see her upper eyelid. And naturally she has low eyebrows and her eyelid is only just apparent. And this is important because as Jennifer ages, it's very important that any procedure that is done to freshen up her appearance is highly conservative and doesn't change this, because it's changes in this area that can really quite radically change a person's appearance. And that's true for both women and even more so for men. And some of the actors who look like they've had a lot of facial surgery, well, it's often the upper eyelid and their brows that have been changed. Now, with good conservative surgery, you couldn't tell. It looks natural, it looks refreshed, but the key here is less is definitely more. And I ask my patients to bring old photographs so I can really see how were their eyes before, because with blepharoplasty and eyelid rejuvenation, we really want to recreate how things were before. We don't want to change a person's appearance, and an old or past photograph could be so helpful in that regard. Detail orientation. Well, when you look at your eyelids, there are so many levels of detail with regards to the anatomy and the fine detail around the anatomy. And so just looking at things in a simplistic way, well, one aspect would be looking at hollowing under the eyes. Another aspect would be looking at how much loose skin there is around the eyelids. A third aspect might be, well, do you actually have a slightly droopy eyelid? And in medicine, that's called a ptosis. Well, it's so important to pick that up at the same time to get the best result. And there can sometimes be just laxity or looseness in the eyelid, and that can require tightening. And if it isn't, well, the eyelid can pull down and you can have eyelid retraction. So it's very important. And then a finer detail is swelling around the cheeks, just below the eyelids. Festoons or malar bags, well, it's so important to pick this up before doing eyelid surgery because it's much harder to treat this, but there are treatments that can have effect and you'd want to do that at the same time. In essence, when it comes to the eyelids, millimeters make the difference. So it's important to look at these fine details to know that you're going to get the very best result. Reviews. Well, in this day and age, we have reviews for everything, and that includes your doctors and your surgeons. And so it is important to look at the background of your doctors. And most surgeons who are doing excellent work will have excellent reviews and good following of patients. At the same time, there's no doctor, no surgeon who can please everyone. So there needs to be predominantly very good and excellent. So what I thought I would do now is just talk you through a few of the classic features of eyelids and what's really going to make a difference to these patients, so that could help guide you in what's going to make the biggest difference to you. So classically, when we look at eye bags, what do we notice? Well, there's this puffiness around the lower eyelids, and this puffiness is caused by fat that surrounds your eye like a cushion, but some of that fat is a mixture of genetics and aging is creeping forwards in the lower eyelid, and it creates this puffiness. And often there's also like loose skin, and there can be quality issues with the skin. And so classic lower blepharoplasty usually involves reducing or taking away some of that fat, and often addressing some of the other features such as the skin quality and loose skin. Hollowness. Well, in the lower eyelid, there can be hollowness, and this can be represented as a dark circle or ring under the eye. And we can see that in this lady, this kind of darkness, a dark shadow. Often this catches the light and can make someone look more tired. In my opinion, the technique is very important when it comes to how to address these lower eyelids, because the most modern way of doing this surgery would be a hidden scar on the inside of the eyelid, and that's termed transconjunctival lower eyelid surgery. And it's very important when you're discussing or seeing a surgeon that they talk to you about how the surgeon's done, because the older way of doing this surgery would be through the skin. Medically, that's called transcutaneous, but that can change the shape of the eyelid, that can give you other changes, and rarely you can get serious issues such as eyelid retraction. So it's very important, the technique on how this surgery is done. I personally like to add volume into this semicircle, into this depression, and I do that with a process called fat transfer, taking a small amount of fat from just around your belly button concentrating that fat and putting it small amount under the eyes, and you can see that really smoothens out this kind of shadowing and depression, and it can take years of your appearance. Skin. Well, patients differ in how much loose skin you have, and the majority of patients that I see have a small or modest amount of loose skin, and I can use a laser to polish and tighten the skin, and I can use regenerative medicine to further the skin quality. And what that means is we don't need to make any scars in the skin. All the surgery can be done on the inside of the eyelid and then polished with a laser. However, if you have like a lot of loose skin, like this patient in this photograph, and you can see there's lots of lines and wrinkles and there's years of aging here, well, this patient needs a bit more than just like laser. And so for these patients, I will take a little pinch, millimeters of loose skin with a small scar just beneath the eyelashes. And that's often hidden in a natural crease. And what that does is it just smoothens out the skin that little bit further. Young patients. Well, I have many patients come to see me in their 20s and 30s, and these patients have no or minimal aging. It's purely genetics, and often you can see some of these changes like puffiness and bags in your parents or siblings, and of course there's a genetic factor that's predominant in these patients. Now in these patients, I feel that, well, less is definitely more. They only need conservative treatment. There are a proportion of patients who will be well suited to non-surgical treatments such as filler. However, not everyone gets on well with filler in this area. It's a challenging area to dress with fillers, and fillers can be troublesome and give you swelling, and some patients don't like the results of fillers and we need them to be dissolved. And in those patients, well, a combination of lower blepharoplasty, all done on the inside of the eyelid with hidden scars, often can give a really good appearance and result. I often combine it with volume replacement such as fat transfer to make that result last many years after the surgery. Revision surgery. Well, revision surgery is challenging in that this is a very delicate area, and there's scarring in the area from the previous surgery, there's a change in the anatomy from the previous surgery, and so all of these things have to be addressed very delicately, because less is definitely more, and it's very easy to increase scarring and increase trouble in this area because it's such a fine and delicate area. However, taking the right measures, patients who haven't had the optimal result from their past surgery can absolutely be helped, and revision blepharoplasty can be a helpful way of restoring the function and appearance of the lower eyelid area. Now, when it comes to looking at the detail around eyelids, it's very important to look at the brows, because some people will have low brows, and if you have low brows, well, it can be really important to lift the brow at the same time as doing blepharoplasty, because otherwise, if you just take away the loose skin, your eyebrow will come down even further and it will sit on your eye. So this patient, this gentleman, well, he had his eyebrows lifted, and you can just see a little bit more of that eyelid. And what that does is it just freshens up your appearance. It doesn't, especially in a man, you don't want to open up the eyelids a long way because it will feminize a person's appearance. But doing this in a modest and conservative fashion, you can really refresh a person's appearance while still keeping it all looking natural. And from my experience, most of my patients, well, most friends, most people they haven't told they've had surgery, they don't notice because you still look like you. It still looks natural. Ptosis surgery. Well, this is looking at the fine detail. And when we look at this patient, you can see this eye looks like normal in height, but this eye is actually droopy. And so in medicine, this is called ptosis. And there can be many different causes, and it's important to look at what those causes are. But a common thing is just natural aging. It's very important when doing blepharoplasty is to notice this at the same time and treat this at the same time, because otherwise, if it's not treated at the same time, it can look even worse after blepharoplasty. So ptosis correction, well, it's different to blepharoplasty, but it can be done at the same time. So number 7 is my tips. What do I think is important when it comes to choosing the best surgeon for you in terms of blepharoplasty? Well, different doctors, different surgeons have different styles. They adopt different techniques based on that style. My personal preference is I like things to look really natural. I don't want patients, friends, family, work colleagues to know that they've had surgery, and so the techniques that I use complement natural looking results, looking at old photographs of patients, and I like patients to have a longer lasting result. They've invested time, energy, resources, things like fat transfer, laser, regenerative medicine. All of these things tend to prolong the results of the surgery, and sometimes there can be additional creams like retinols that can also be helpful for skin quality. Cost versus quality. Well, like many things in life, you can always get things at a lower cost, but is it worthwhile when you think about what the implications are? And things like hospital tourism, patients going to Eastern Europe for cheaper surgery, well, I personally don't think this is the best idea, because seeing patients who then need further surgery, well, it can be frustrating because it can be more difficult to correct those things at a second time. And doing things in terms of time, well, blepharoplasty can be completed in a half an hour to an hour, but doing things with detail and precision and taking the extra time, blepharoplasty really takes a minimum of an hour and a half to 2.5 hours, and sometimes even 4 hours if it's involving things like your brow and fat transfer. But ultimately that can give a longer lasting result, and that can be helpful in the long term. Newer technology, well, there's always new technology arising. There's improvements in laser, and I recently invested in a state-of-the-art laser to improve things that little bit further. But there are other technologies that promise a lot but are yet to truly deliver. And there's a technique that uses heat and a radio frequency to tighten the skin. And that kind of technique, well, it's not truly non-surgical, and certainly the patients who've come to see me have been a little bit disappointed by Plexa because they haven't seen that much of a difference. Now, that's not to say it doesn't make any difference, but the patients who come to see me have been a little disappointed because there's been recovery, and they probably would have got a better result from just doing blepharoplasty with a similar recovery. So I think with new technology, it's always good to have innovation, but it needs to be properly looked at and researched before it can promise the results. Patient experience is really important, and it's an emotional decision to have any kind of cosmetic surgery, including blepharoplasty, and you need to be prepared for recovery, and it can be an emotional journey. And for my patients, I provide supportive care because I think that's a very important aspect of like delivering this kind of medicine. But sometimes it's important to ask these questions. What will the support be after surgery? How many times are you going to follow me up after surgery? Can I come and see you if there is anything? These are really important considerations. Operating facility, well, some facilities will involve you going to a private hospital. Some facilities may involve you having the procedure under local anesthetic. My personal preference, well, I take patients to my custom-built facility, which is set up really towards twilight anesthesia and sedation, because from my experience, that gives patients the smoothest journey and fast recovery. So all my patients, they go home less than an hour after the surgery. And finally, life events. And everyone's life is a bit of a roller coaster. There's certain points that you're on top of the world and you can take on many things. And there's certain points where you may be feeling low, you may have come out of a relationship, you may have an issue with your work or profession. And all of us have that to some extent. Life is a roller coaster. You never want to go and have a surgical procedure like blepharoplasty if right now it's quite an emotional moment. I would recommend just waiting, giving time for things to settle. And once things have plateaued, well, that would be the best time to consider having blepharoplasty. So in summary, well, these are things we've talked about. What are the right credentials? What can be determined as extensive experience? The importance of past or old photographs in defining what should be done. The importance of being detail orientated is very important when it comes to this type of surgery. Looking at doctors' reviews, We also looked at different cases and proven results to give you an idea of what could be important for you, and then my personal tips. So I think that's all I was planning to talk about for you today. If you have any questions or any other thoughts based on this, please don't hesitate to get in touch. You can either call us, you can send me an email or message me, and I hope this information has been useful for you. Thank you for watching.